Alright, clean this table. You have to let it dry before you can use it. Okay, next thing we gotta have to position this patient properly. Put the patient flat. Okay, raise the bed to the level of comfort for you. So put the arm, extend the arm about 90 degrees. Alright honey, relax. See this thing? 90 degrees. Just like that, so you know what you're working on. You can help so the patient doesn't keep on moving the arm. You could just temporarily use the tape. And now you have the work in front of you. You have a little space here you can work on. Okay? So, before you do the procedure, wash your hands. Remember the rule of 2 times happy birthday? Sing the happy birthday 2 times. No. In your hands, that should be effective. Dressing kit, extra gauze, stat lock, injection cap, bio patch. You can use alcohol pads, or you can use chlora scrub, and then saline flushes. Okay. Put on your unsterile gloves first. Okay. Your unsterile gloves, very important. After you washed your hands, position this arm again. This is a very important key to your procedures when you position the arm. Okay. Okay, now we're ready. We want to set up everything, all your supplies. The kit is very important. You have a mask here that you have to wear. Wear your mask. Okay, and then set up your stuff. This is your sterile drape. You can hold it, but hold it on the edges so you're able to save it, and then hold the edges. Put part of it underneath, so you have a sterile field there, right there. Okay. Then your gloves, hold it on the tip too, because you will need this later as I will explain it to you. Alright. Then everything can be placed there. Alright. Then you have, open your stat lock, because you will need this. Open your gauze. You can put your gauze. This is how I use the gauze. I know this is not routine on your kit, but here's your gauze. Put it on the side. You can use another one in case you need one more. No. Here you go, sweetie. Let's straighten this out. And then open your bio patch. May or you may not open that thing yet, but okay, so there you go. Now you're ready to remove the old dressing, and this is how you remove it. Okay, you start from the bottom. You start from the bottom here. You remove the, and this is how I do it. Okay, I remove from the bottom. This is sometimes a little bit difficult, but here we go. Now, there are times when it's difficult to remove this. You can use alcohol. Okay, like that. If it's not difficult to remove, then you probably won't. But when you're removing this to prevent migrating the catheter, causing the catheter to migrate, you need to hold with your other hand, either the left or the right. Look at me. You're holding it. Okay, you're peeling this off, going up. but follow it with your finger. Now you can remove the whole thing because we're gonna change the stat lock anyway. So remove it from the side, on the other side. But the whole idea is that you're pulling it up, not down. Now when you're removing this, because you have to remove the stat lock, you can look at my finger. Okay, it doesn't matter if we ruin the stat lock now, because anyway we're going to change it. But look at my finger where it is. Okay, now once that's done, your next step here will be to remove this thing here. Okay, then lift this. Remember? Lift. I haven't caused it to migrate. Look at this. So now that's open. You remove everything, it's open. Okay, what's your next step? Before you put on your sterile gloves, put a couple of syringes saline, the gauze, wet the gauze, because this is what you're going to use to clean some more. Okay, now I'm ready. I'm going to remove my unsterile gloves. Put on your sterile gloves now. Here's your sterile gloves. Now this is now what I was saying on what you're going to do with this. You can use this to hold. See, you still keep your arm, your hand sterile, because this was the sterile container of your gloves. Okay, what's the use of your salinized gauze? This is what you use it for. See this? You can hold this. Focus on that. See that? You see that yellowish thing? You have to remove it, and you can use this gauze. You can you know, honey. Do not be afraid to hold this thing, because that's okay. We are going to. Okay, so now it's clean. That's the whole essence of it. You can get another dry 4x4. Clean it, okay? Now that we've done that part, you can use Chloroprep to paint the area. Paint it. Okay, remember your sterile technique. So clean it again. You can also paint the back of it. Alright. Okay, now we're done with that. We can let it dry. Very important. Let it dry. Air dry is the word. The next thing you're going to do is to put your bio patch. But you have to make sure that's really dry. Okay, like that. I think it's dry already. So here's your bio patch. The technique for the bio patch application is the slit has to face up. So later on when you're removing it, it's easy. So lift this a little bit. Put the slit like that. There you go. Okay? And then your stat lock. Lift it again. And then put the stat locks on. See, if you don't let this dry up, it may not stick. Some of you might want to use this, which is fine. This is part of the kit. You can use it if you want to. So there you go. And you will notice that I purposely put part of the bio patch under the stat lock so that the bio patch is 360 degrees in contact with the skin. That's what bio patch wants you to do. The bio patch has to be 360 degrees in contact with the skin. If we put it on top, then part of this will be sitting on the stat lock, but this one now is sitting under the stat lock and in contact with the skin. Okay, now you can, this is very important, all the time this is forgotten. This is called an adhesive strip. Use it to anchor it at this part of the catheter. Okay, so that only this part moves. So now you're ready. If you want to use this to paint the skin so your tegaderm sticks well, you can paint the skin around with this so it sticks well. This is fine. Okay, there you go. Now that sticks. Alright. Here is your tegaderm. Remember this? Some of you are still putting it on top. You don't use this. Do not put it on top. Okay, now we're ready. This is also important because this is always forgotten. Your bio patch should be in the center of this. This slit should be somewhere here. So kind of eyeball it first before you move it. Stick it on one side so you can make sure that it's sitting good. Okay, this is kind of tricky here, but now that's sticking good. Okay, now if this arm was big, like if this was like a 50 centimeter arm big, you can use two actually, one here and one here. I have a video clip that shows you two tegaderms. So one for this size of arm is good enough, but you see that only this part moves, the rest is covered. Your bio patch is in contact with the skin 360 degrees. The slit is close together. The stat lock is intact. That's how you do it. Okay? Alright, our next step is, as long as you're doing this on your first week, is you need to change the cap and clean the hub. Okay, and this is how I do it. Make sure it's closed. You can use, first of all, set up your flush so that you're ready. Remove the air. You can put it on the side. Then make sure that's closed. Get your chloroprep, split or tear it from the middle so you can hold the edge of this. Okay? That part is sterile, that part's sterile. I'm only holding the edge of it. Now remove the cap. See, that hub needs to be cleaned. And here's your sterile chloroprep. Wrap it around and scrub it, what, 15, 20 times or seconds. Make sure you remove everything. You can do a double, I'll show you in a few minutes. Okay, you can also, that was chloroprep. If you use an alcohol, you can use 2 or 3 or 4, doesn't matter. Let's say we have 4 in here. Split it from the center, hold the side, hold the hub like that, wrap it around with your alcohol, and scrub it. Okay? So now that is really clean, because we did this twice already, but you don't have to do it twice. Once is enough for 15-20 seconds. Let that hub, the tip of the hub, air dry, because alcohol, if you don't let it air dry, is not going to be effective. Let it air dry. Alright, 15, 20. Okay, once you're ready, remove the air, attach it, open it. What's the first thing you need to do? Check it for blood return. There's a good blood return here, flush. I was made to believe your caps are neutral caps. So when you have neutral caps, you don't have to do anything. You just flush it. You can clamp it before you remove it. You can remove it without clamping and clamp it at the same time. Okay, so there you are. The only thing missing here now is the label, which we're gonna do last. Okay. Now, how about this tip? This is very important. This is how it comes out. If you let this dangle like this, chances are when you move your patient, this is gonna get caught and this is gonna get pulled out. So this is your remedy to it. Although this is short, you can cover this as long as it's not being used, just like that, so nothing is dangling. It would have been nice if this cover is from here to here, so everything is covered. So let's summarize. Let us summarize. You have, let's summarize this. You have a line that we just did a dressing change. You got a label, the date. Look at the biopatch. It's 360 degrees sitting on top of the skin, which is what biopatch wants. You have a new stat lock. You have a tip that's been, the hub that's been cleaned, changed cap. Then this is covered, it's clamped, it's covered so that nobody touches it. You will also need to measure the arm circumference of this PICC line site, and make sure you have one of this nice paper ruler. Okay, let's do an arm measurement now. You measure it about 3 or 5 centimeters above the insertion site. So your insertion site is there. So it'd be either from here or here, somewhere there. Arm measurement, 22 centimeters. No swelling. We looked at it earlier. There's no swelling, no redness, no pain. That is a nice dressing with everything done correctly. Biopatch, new stat lock, labeled correctly. Tegaderm sitting on top of the dressing with the biopatch in the center. Clamps closed, hubs changed, cleaned, and cap changed. There you go. I will, if you have any questions, please let me know. Thank you. I forgot. This one, your saline flashes has got this nice alcohol. This is actually just alcohol. It wraps around the tip to keep this tip clean. You apply it by, this is like a lure lock. It just keeps the tip clean because it's soaked in alcohol. Okay, so remember this is the reason why the tip of your saline flashes has got that alcohol. Nice feature. If you don't use it, it's useless. Thank you.